say the least.
Yeah, right, right.
So this is Patricia, and you had a chronic problem with your back before you came to see me. Right.
Right. Well, I'd had issues with my right hip area for a long time, but then about a year ago, I guess it would be, I developed sciatica, and that was pretty severe and unrelenting, and to the point that I couldn't sit, couldn't sleep, couldn't get out of bed. I mean, it was pretty bad.
Yeah.
By the time I came. And I don't remember exactly when my first appointment was, but I think it was maybe back in June or something like that. I'd had symptoms probably for 6 months. So, and now, this is my 5th treatment. Yeah, sometimes I barely notice that it's there. It's mostly gone. I would put it like where before the pain was probably constantly an 8 or 9, maybe sometimes a 1, but somewhere 1, 2-ish. So a lot better.
And do you take any medication or anything for it? Yeah.
Every once in a while I might take a couple Tylenol on a bad day, but no, and I can turn over easily in bed, I can hop out of bed in the morning, I can stand on one leg, put my pants on. The nurse just noticed, wow, you were, because I was taking my pants off. But yeah, so it's easier, I can get dressed and move. And the only issue I have at this point still is sitting sometimes bothers it, if I sit for a long time. But yeah, much better.
Yeah, and you were saying originally it was a real struggle or a challenge to get in the car to drive down from...
I lived 5 minutes away from where I worked, and I could barely drive home.
Right.
Yeah. So sitting in a car in particular I couldn't do it. It was impacting my life pretty severely. So.
Yeah. And you just drove how many hours?
2 hours.
2 hours to get here today.
Yeah.
Okay.
So.
Fantastic.
Yeah.
Well,
it's great.
So,
I'm a believer.
in PRP Prolotherapy.
Yeah.
Absolutely.
PRP Prolotherapy.
Well, thank you.
Yeah.